Prostate cancer is the second leading cause of cancer death in men in the United States. Statistical data reveals the significant impact of prostate cancer on male mortality rates. Understanding the prevalence of prostate cancer is crucial for early detection and effective treatment strategies. Increased awareness and screening programs are vital in reducing prostate cancer mortality. PSA, or prostate-specific antigen, is a substance produced by the prostate gland. A blood test measures the level of PSA in a man's bloodstream. Elevated PSA levels can indicate potential prostate issues, such as inflammation or cancer. PSA levels are used as an indicator and do not provide a definitive diagnosis. Further testing is required to determine the cause of elevated PSA levels. Regular PSA testing can help in the early detection and management of prostate health. Elevated PSA levels do not definitively indicate the presence of prostate cancer. A high PSA level can be caused by factors other than cancer, such as benign prostatic hyperplasia, BPH. Normal PSA levels do not guarantee the absence of prostate cancer. Prostate cancer can be present even when PSA levels are within the normal range. PSA levels should be interpreted in conjunction with other diagnostic tests and clinical evaluations. Prostate-specific antigen, PSA, is a protein produced by both healthy and cancerous cells of the prostate gland. PSA is present in small quantities in the serum of men with healthy prostates. Elevated PSA levels may indicate the presence of prostate cancer or other prostate disorders. PSA testing is used as a screening tool to detect early prostate cancer. The prostate gland is a male reproductive organ located below the bladder. The prostate gland's primary function is to secrete seminal fluid, which contributes to semen volume and sperm motility. Prostate-specific antigen, PSA, is a protein produced by both normal and cancerous prostate cells. PSA levels in the blood can be used as a marker for prostate health, with elevated levels potentially indicating prostate cancer or other conditions. Elevated PSA levels do not always indicate prostate cancer. Prostate-specific antigen, PSA, levels can increase due to non-cancerous conditions such as prostate irritation. Cycling can sometimes cause temporary prostate irritation, leading to elevated PSA. It is important to consider various factors that may influence PSA levels before diagnosing prostate cancer. Further medical evaluation is necessary to determine the cause of elevated PSA and rule out cancer. Normal PSA ranges vary across different age groups. Widely accepted guidelines define these age-specific PSA thresholds. PSA levels are measured in nanograms per milliliter, NN, ml. Elevated PSA levels may warrant further investigation. These ranges serve as a reference for healthcare professionals. Regular monitoring and age-appropriate screening are crucial. PSA levels should be interpreted within the context of individual trends over time. Focusing on the rate of change in PSA levels provides more clinically relevant information than a single absolute value. An increasing PSA trend, even within the normal range, may warrant further investigation. Isolated PSA measurements are less informative than a series of measurements that establish a pattern. PSA velocity indicates the rate of change in prostate-specific antigen levels over time. A slow, steady increase in PSA levels is represented by a gradual upward sloping line. A rapid jump in PSA levels is shown as a steep, almost vertical increase on the chart. Comparing the slopes visually differentiates between slow and rapid PSA velocity. Benign prostatic hyperplasia, BPH, is a common condition in older men. BPH involves the non-cancerous enlargement of the prostate gland. Prostate enlargement can lead to urinary symptoms such as frequent urination. BPH can cause an elevation in prostate-specific antigen, PSA levels. Elevated PSA levels do not always indicate prostate cancer. BPH is a common non-cancerous cause. Diagnosis of BPH involves physical exams, PSA tests, and other evaluations to rule out other conditions. Prostatitis is characterized by inflammation or infection of the prostate gland. Inflammation can be caused by bacterial infection, leading to acute or chronic prostatitis. Non-bacterial prostatitis involves inflammation without detectable infection. Prostate inflammation impacts the production and release of prostate-specific antigen, PSA. Elevated PSA levels may indicate prostatitis, but can also be caused by other conditions. Diagnosis of prostatitis involves physical examination, urine tests, and PSA level assessment. Prostate-specific antigen, PSA levels, can be temporarily elevated by various lifestyle factors. Sexual activity can cause a transient increase in PSA levels due to prostatic stimulation. Strenuous exercise may lead to a temporary rise in PSA as a result of increased blood flow and pressure. Activities such as lawn mowing can also contribute to a temporary elevation in PSA, possibly due to physical exertion and vibration. African American men face a statistically higher risk of developing prostate cancer. Genetic predisposition, indicated by family history, is a significant risk factor for prostate cancer. Risk factor analysis involves identifying and evaluating elements that increase the likelihood of disease development. Understanding risk factors allows for targeted screening and preventative strategies. Prostate cancer risk assessment combines demographic data and family history for personalized evaluation. Individual risk factors should be discussed with a doctor to determine appropriate PSA testing frequency. Shared decision-making between doctor and patient is crucial for personalized healthcare plans. PSA testing frequency should be tailored based on a comprehensive understanding of individual health profiles. Regular consultations with healthcare providers enable informed choices regarding preventive screenings. Understanding personal risk factors empowers patients to actively participate in their healthcare management. PSA velocity measures the rate of change in PSA levels over time, aiding in risk assessment. Free PSA percentage is the ratio of unbound PSA to total PSA, providing additional diagnostic information. PSA density assesses PSA levels relative to prostate volume, refining risk stratification. Combining PSA velocity, free PSA percentage, and PSA density enhances the accuracy of risk assessment. Elevated PSA velocity may indicate rapid disease progression, prompting further investigation. Low free PSA percentage suggests a higher likelihood of aggressive disease, influencing treatment decisions. Refined PSA measurements can help determine the necessity of biopsies. Unnecessary biopsies can be avoided through precise PSA level analysis. Avoiding biopsies reduces patient stress and discomfort. Advanced PSA testing methods offer more accurate risk assessment. Improved diagnostic accuracy minimizes unnecessary invasive procedures. The UK, Japan, and Sweden employ different approaches to PSA screening. Each country's approach to PSA screening reflects its unique healthcare system and cultural context. Variations in PSA screening protocols impact early detection rates and treatment strategies. The effectiveness of PSA screening is assessed by monitoring prostate cancer incidence and mortality rates. Comparative analysis of PSA screening strategies informs evidence-based healthcare policy. Research suggests a potential correlation between specific dietary habits and lower PSA levels in Japanese men. Dietary components such as fish, soy, and green tea may contribute to reduced PSA levels. Further research is needed to confirm the causal relationship between diet and PSA levels. PSA, prostate-specific antigen, levels are often used as an indicator of prostate health. The observed link may be influenced by genetic or environmental factors specific to the Japanese population. Understanding dietary influences on PSA levels could inform preventative health strategies. Lifestyle factors significantly influence prostate-specific antigen, PSA, levels, impacting interpretation globally. Dietary habits, such as high-fat intake, can elevate PSA levels, potentially leading to false positives. Regular physical activity is associated with lower PSA levels, contributing to more accurate diagnostic interpretations. Healthcare access and screening practices vary globally, affecting the stage at which prostate cancer is detected via PSA testing. Cultural beliefs and attitudes towards healthcare influence PSA testing frequency and subsequent interpretation. Standardized PSA interpretation guidelines are essential to mitigate the impact of lifestyle and healthcare disparities. In the United States, early warning systems are crucial due to the prevalence of heart disease and cancer. PSA, or public service announcements, serve as a primary method for disseminating crucial health information. These announcements aim to increase awareness and promote early detection and prevention strategies. Effective PSA campaigns contribute to improved public health outcomes and reduced mortality rates. A marathon runner experienced a temporary spike in prostate-specific antigen, PSA, levels after the race. PSA levels can temporarily increase due to physical exertion and inflammation. The elevated PSA levels subsequently return to normal after a period of rest and recovery. Transient PSA elevations do not necessarily indicate prostate cancer. Monitoring PSA levels over time provides a more accurate assessment than a single measurement. Further evaluation is recommended if PSA levels remain elevated or continue to rise. A veteran patient presents with a stable, slightly elevated prostate-specific antigen, PSA, level. The patient's condition is being monitored without immediate biopsy due to the stability of the PSA levels. Regular PSA testing is conducted to track changes and assess the need for further intervention. Monitoring allows for a more informed decision regarding biopsy, balancing risks and benefits. This case study illustrates a conservative approach to managing slightly elevated and stable PSA levels in a veteran patient. Elevated PSA levels can indicate potential prostate issues, prompting further investigation. Early detection of prostate cancer through PSA screening allows for timely intervention and treatment. Regular PSA testing is crucial for monitoring prostate health, especially for individuals with risk factors. Treatment options for early-stage prostate cancer may include surgery, radiation therapy, or active surveillance. A comprehensive approach to prostate cancer management involves regular monitoring and personalized treatment plans. Early detection of elevated PSA levels can significantly improve treatment outcomes. Prompt action following a PSA test is crucial for effective intervention. Increased awareness of PSA testing benefits, proactive health management. Knowledge of PSA levels empowers informed decisions regarding prostate health. Prostate-specific antigen, PSA. Discussions with a doctor are recommended starting around age 45. Individuals at high risk should initiate PSA discussions with their doctor at an earlier age. PSA discussions involve understanding the benefits and limitations of PSA testing. Early PSA discussions can facilitate informed decisions about prostate health monitoring. Regular PSA monitoring, guided by a doctor, aids in the early detection of potential prostate issues. A baseline PSA test in one's 40s provides a reference point for future comparisons. This baseline allows doctors to more accurately assess changes in PSA levels over time. Early detection of changes can lead to more timely and effective interventions. Regular monitoring against a baseline can improve long-term health outcomes. A diet rich in vegetables is beneficial for prostate health. Regular exercise contributes to maintaining a healthy prostate. Limiting processed foods is important for prostate health. Adopting a heart-healthy lifestyle benefits overall prostate health. Repeating tests is crucial for confirming initial results and ensuring accuracy. Tracking trends over time provides a more reliable assessment than relying on a single data point. Consulting specialists offers expert interpretation and comprehensive evaluation of test results. A single test result can be influenced by various factors, leading to potential inaccuracies. Comprehensive medical decisions should be based on a holistic view, integrating multiple tests and expert opinions. PSA levels should be interpreted within the context of a patient's overall health profile. Age is a significant factor when evaluating PSA levels. Lifestyle factors, such as diet and exercise, can influence PSA levels. Family history of prostate cancer is a crucial consideration in PSA interpretation. A comprehensive health assessment provides a more accurate understanding than PSA alone. Men are encouraged to proactively manage their health through regular checkups and screenings. Taking charge of one's health involves actively seeking information and asking relevant questions during medical consultations. Prioritizing preventative measures can significantly reduce the risk of developing serious health conditions. Early detection through screening allows for timely intervention and improved health outcomes. Prostate-specific antigen, PSA levels, typically correlate with age. The typical range of PSA values increases as individuals age. This correlation is visually represented by an upward-sloping trend line on the age versus PSA graph. Elevated PSA levels may warrant further investigation, especially in older individuals. Understanding age-specific PSA ranges is crucial for accurate health assessments. Benign prostatic hyperplasia, BPH, involves the non-cancerous enlargement of the prostate gland. The enlargement of the prostate gland in BPH can compress the urethra, causing urinary symptoms. BPH primarily affects men as they age, with the prostate gland gradually increasing in size. The progression of BPH can lead to various lower urinary tract symptoms. The prostate is located inferior to the bladder. The prostate is situated anterior to the rectum. The urethra passes through the prostate. The prostate surrounds the urethra just below the bladder. The prostate's proximity to the bladder and urethra is critical for urinary function. Prostate-specific antigen, PSA, levels can vary significantly across different ethnic groups. Comparative analysis reveals that African American men tend to have higher average PSA levels. Elevated PSA levels in African American men indicate a potentially higher risk of prostate-related conditions. Regular PSA screenings are crucial for early detection and management, especially for high-risk groups. Genetic predisposition and environmental factors may contribute to the observed differences in PSA levels. Further research is needed to fully understand the underlying causes and implications of these ethnic disparities in PSA levels. A family history of prostate cancer increases individual risk. Increased risk is associated with having a father diagnosed with prostate cancer. Increased risk is also associated with having a brother diagnosed with prostate cancer. Genetic predispositions play a significant role in prostate cancer development. Prostate scans allow doctors to visually assess the size and shape of the prostate gland. Measurements from prostate scans are used to calculate prostate-specific antigen, PSA, density. PSA density is an important indicator in evaluating the risk of prostate cancer. The scan provides a visual reference for determining the prostate's volume. Doctors use prostate size, along with PSA levels, to determine the need for further diagnostic procedures. A world map illustrates the varying approaches to PSA screening across different countries. Different nations adopt diverse strategies for prostate-specific antigen, PSA, screening. These approaches range from national screening programs to shared decision-making models. The map visualizes the global distribution of these diverse PSA screening strategies. Data-driven analysis supports the comparison of PSA screening outcomes across different regions. The visual representation facilitates understanding of the global landscape of PSA screening practices. The Japanese diet commonly includes fish, which provides essential omega-3 fatty acids. Soy-based foods, a staple in the Japanese diet, are rich in plant-based protein and isoflavones. Green tea, frequently consumed in Japan, is known for its antioxidant properties. These dietary components may contribute to overall health and well-being. A balanced Japanese diet emphasizes fresh, whole foods with minimal processing. Prolonged cycling can potentially irritate the prostate. The repetitive pressure from cycling seats can contribute to prostate discomfort. Adjusting seat height and angle may help alleviate pressure on the prostate during cycling. Alternative exercises should be considered to minimize prostate irritation. This simulation recreates a doctor-patient consultation regarding PSA testing. PSA testing involves measuring the level of prostate-specific antigen in the blood. Elevated PSA levels may indicate prostate cancer, but can also result from other conditions. Risk factors such as age, family history, and race can influence the likelihood of prostate cancer. Informed decision-making requires understanding both the benefits and limitations of PSA screening. PSA velocity is determined by measuring the change in PSA levels over time. A rapid increase in PSA velocity may indicate a higher risk of prostate cancer. A slow, steady increase in PSA velocity typically indicates a lower risk. PSA velocity graphs aid in differentiating between benign and malignant prostate conditions. Regular PSA testing is essential for monitoring PSA velocity trends. PSA velocity, combined with other diagnostic tools, enhances prostate cancer detection. Free PSA, or prostate-specific antigen, is a form of PSA circulating freely in the blood. PSA is a protein produced by cells of the prostate gland. The level of free PSA in the blood can be used as an indicator of prostate health. A lower percentage of free PSA may indicate a higher risk of prostate cancer. Free PSA is typically measured as a percentage of total PSA. Measuring free PSA helps to differentiate between benign prostate conditions and cancer. A prostate biopsy involves extracting small tissue samples from the prostate gland for microscopic examination. The procedure is performed to detect and diagnose prostate cancer or other abnormalities. Biopsy samples are typically obtained using a transrectal ultrasound-guided approach. The extracted tissue samples are then sent to a pathology lab for analysis and diagnosis. An online risk calculator assesses individual risk based on specific factors. Age is a key factor considered in the risk assessment calculation. Ethnicity is factored into the risk calculation to account for genetic predispositions. Family history provides critical information for assessing inherited risk factors. PSA levels are integrated as a quantitative biomarker in the risk assessment model. Lifestyle recommendations for prostate health include dietary adjustments and regular exercise. A diet rich in fruits and vegetables supports prostate health by providing essential nutrients and antioxidants. Regular physical activity improves circulation and reduces inflammation, contributing to a healthy prostate. Maintaining a healthy weight and avoiding processed foods are beneficial for prostate health. PSA testing involves measuring the level of prostate-specific antigen in the blood. The recommended age to begin PSA testing typically ranges from 50 to 55 years for men at average risk. For men at higher risk, such as African American men or those with a family history of prostate cancer, testing may begin earlier. The frequency of PSA testing is determined by individual risk factors and initial PSA levels, typically ranging from annual to biennial. A medical report provides key information, including PSA levels. PSA levels are an important indicator in medical diagnostics. Medical reports contain various data points relevant to patient health. Accurate interpretation of medical reports is crucial for effective healthcare decisions. Prostate cancer treatment options vary depending on the stage and aggressiveness of the cancer. Active surveillance involves closely monitoring the cancer without immediate treatment, suitable for slow-growing, low-risk cases. Radiation therapy uses high-energy rays to kill cancer cells, delivered externally or internally through brachytherapy. Surgery, such as radical prostatectomy, involves removing the entire prostate gland and surrounding tissues. Hormone therapy aims to lower testosterone levels, which can slow the growth of prostate cancer cells. Follow-up appointments are crucial for monitoring patient progress and treatment effectiveness. Regular monitoring allows for timely adjustments to treatment plans based on patient response. Consistent follow-up helps identify and address potential complications or side effects early on. Scheduled appointments ensure adherence to prescribed medications and therapies. Effective follow-up enhances the patient-provider relationship and fosters trust. Proactive follow-up contributes to improved long-term health outcomes and reduced healthcare costs. Sharing information about PSA testing promotes informed healthcare decisions. Discussing PSA testing with a doctor facilitates personalized risk assessment and management. Encouraging dialogue about PSA testing empowers individuals to take proactive steps for their health. Informed discussions about PSA testing can lead to earlier detection and improved health outcomes. Sharing accurate information helps dispel myths and misconceptions surrounding PSA testing. Promoting open communication about PSA testing fosters a culture of health awareness and proactive care.